who performs medical evaluations for chronic fatigue syndrome. Have you ever wondered who is involved in the medical evaluations for chronic fatigue syndrome? This condition, also known as myalgic encephalomyelitis, is complex and requires a variety of healthcare professionals for proper assessment. The journey often starts with primary care physicians. These doctors are usually the first point of contact. They perform initial assessments to rule out other potential causes of fatigue. This involves taking a detailed history, conducting physical examinations, and ordering basic laboratory tests. They look at how long symptoms have lasted, their severity, and how they impact daily life. Common conditions like vitamin deficiencies or thyroid disorders that can cause fatigue are also screened. If further evaluation is needed, specialists in internal medicine or infectious diseases may step in. Chronic fatigue syndrome can affect multiple organ systems and sometimes follows infections. These specialists help to provide a more detailed evaluation and rule out other medical or infectious causes. In cases where symptoms suggest autoimmune or neurological issues, rheumatologists or neurologists may become involved. They can help identify if the fatigue is related to conditions that affect the muscles, joints, or nervous system. When cognitive symptoms like memory or concentration problems are significant, clinical neuropsychologists may conduct evaluations. They assess cognitive function to differentiate between CFS-related cognitive impairment and other potential causes. Some patients are evaluated in multidisciplinary clinics. These specialized centers often include teams of physicians, psychologists, and rehabilitation specialists who work together to provide a thorough assessment. The evaluation process typically includes a comprehensive clinical history, physical examination, and exclusion of other medical conditions through lab tests or imaging when necessary. There is no single test for chronic fatigue syndrome. Diagnosis relies on established clinical criteria. This includes persistent fatigue that cannot be explained by other causes, along with symptoms like post-exertional malaise, unrefreshing sleep, and cognitive difficulties. Because the symptoms of chronic fatigue syndrome can overlap with many other conditions, careful differential diagnosis is essential. Patients should seek care from providers who have experience with chronic fatigue syndrome to ensure they receive an accurate diagnosis and appropriate management. In summary, evaluations for chronic fatigue syndrome are conducted by primary care doctors and various specialists, often within multidisciplinary settings, to provide comprehensive and personalized care.